Good morning. I think we need to start changing the gear a little bit and thinking ahead of time. Yeah, so I will be shifting the gear a little bit. See, yesterday and today we've had a lot of work that is going on in terms of developing the evidence base and also looking at the extent to which MMS can be rolled into our routine programs. And I want to take us back to where we started yesterday in the morning when Lucy did give us a policy landscape of what is happening at the continent level, talked about the African Leaders for Nutrition and its mandate to support high-level political leadership in terms of ensuring that our policymakers or the people who've got the power to make things happen understand what we are talking about and drive both the legislative, policy and investment decisions that we are supposed to put in place to address malnutrition in the continent of Africa. So Lucy also yesterday talked about the Continental Nutrition Accountability Scorecard, and she didn't talk about the role of that scorecard as a tool to help our ends of state at that level to be able to take the right action. First of all is understanding the magnitude of the problem, but the second thing is helping them to know what needs to be done, where we need efforts. And my colleague, George Ouma, the first day also talked about how we have come up with champions who are heads of state who are supposed to help galvanize both legislative policy and financial efforts at the continent level to address malnutrition. So I have talked about the mandate that is given to the African Leaders for Nutrition, and there is an African Union decision that required that AUC, together with the African Leaders for Nutrition and the African Development Bank, then develop a tool that will help leaders to talk with the same voice. Because as you realize, there are so many differences in terms of what we are talking. And therefore, the Continental Nutrition Accountability Scorecard is that tool that we use every year to help leaders at the continent level talk about the effort they are making in terms of reaching the various global and the continent-wide targets to address malnutrition. So what we have here is our thinking in terms of how we saw that happening. We needed a tool that helps us understand how we to address malnutrition. First of all, we need to sort out the enabling environment. We have issues to do with governance, policy, and also the investment decisions. And then we've been talking about rolling out MMS, for example. And if you listen to the language, you've been talking about, to a large extent, very few sectors. But you realize for us to be able to actually have an impact on it, we need to adopt a more multi-sectoral approach. And that's why we have a focus on service coverage. And these the services of interest here are the ones that deliver both nutrition-specific and nutrition-sensitive sectors. And then we also now look at the core business, the nutrition status. And our thinking is that once we sort out the enabling environment, we improve service coverage, and sort out nutrition, then of course we will have the socio-economic impact that is actually driving us into sorting out the problem. So the Continental Nutrition Accountability Scorecard in a nutshell is to a large extent informed by the World Health Assembly infant, young, and feeding indicators that were released in 2014 that actually captures the indicators that we need to be thinking about. But then our business here is high-level political leaders. It's not the technical people like ourselves in this room. We need a core set of indicators that will help political leaders, in a nutshell, realize where the problem is and then start preferring or thinking about solutions. So the indicators that we have within the Continental Nutrition Accountability Scorecard are organized along those four categories. We've got indicators that are of interest to what we are talking about here, nutrition status, others within the service coverage, financing, and the socioeconomic impact. We are all familiar with the World Health Assembly targets. that we were supposed to achieve by next year. Of course, they have been reprogrammed to the SDGs and by 2030. And this, to a large extent, is what forms the backbone of the Continental Nutrition Accountability Scorecard. So in 2019, the very first version of the Continental Nutrition Accountability Scorecard was released. It was paper-based, and it had 12 indicators across these sectors. And in 2019, following the release of this scorecard by His Majesty King Lesia, who is the African Union champion for nutrition, who I said every year provides a report of the progress that the continent is making in terms of addressing malnutrition, released the first version. But the same year, the SDC, the Specialized Technical Committee, requested that it be developed in a digital platform so that it can be able to improve use. And in 2021, we did manage to develop a digital nutrition version of the scorecard. We've got the link there. You can be able to see how countries are doing across all the indicators of interest, including anemia among women of reproductive age, for example, and all other indicators of interest like the low birth weight, which is, of course, an outcome indicator of micronutrient deficiency. You can be able to see how each country is performing. And why is this important? When yesterday we were talking about implementation science, we are starting now to think about the nuts and bolts that will make our policymakers adopt the kind of recommendations that we are coming up with into our routine programs. It will be beyond evidence. Evidence is part of it, cost is part of it, but there are several other issues that we need to take into consideration so that then we can be able to persuade our political leaders to push for it. And this is one such platform that we can be able to use to be able to get our leaders to think about it. But the Continental Nutrition Accountability Scorecard is primarily based on secondary data. ALN and AUC do not collect primary data. What that means, if we were, for example, to take an indicator which has got something to do with MMS in the scorecard, data must be available. It needs to be available so that then we can take it at a continent level and be able to make the case and use it for advocacy alongside the thinking and what we've had in the previous 2 days about how we are involving our political leaders. So very quickly, I want to show you the indicators that we have that are basically talking about nutrition status. We've got an indicator on stunting, wasting. We've got overweight, again, among children under 5 years. But we've got also an indicator on women of reproductive age who have anemia and low birth weight. When you look at the other categories, we also have the MDD, and we've got exclusive breastfeeding. The other indicators that we have basically cover services, and we have the health services, and which, to a large extent, is the delivery platform of choice for MMS. We've got 4 indicators in there. We've got some on social protection, and of course it has got the population that are living below poverty line has got everything to do with the discussion we are having about affordability and ease of access. Then we've got 2 indicators there talking about the policy and the legal provisions, about legislation on mandatory fortification of cereals and legislation on code of breastfeed, marketing of breast milk substitute. And where are we going with this? You've realized already the WHO targets have been revised, and even the infant and young feeding program indicators were revised. And to make sure that the Continental Nutrition Accountability Scorecard is fit for purpose, we are now opening it for review so that it takes a number of other emerging issues, including the discussions we are having here on how can we introduce MMS as a way of taking up the other micronutrients supplementation programs we have. So this presents an opportunity where we can be able to latch into it and then bring our political leaders to support the adoption, the rollout, and the programming of MMS within our health sector and other sectors that we'll be talking about. I want to end it there, and I will be happy to answer your questions.